Okay, more study. This time I have realized I skipped a section, and that was the section that on the test I had the most trouble with. Social insurance. This section will discuss social insurance and its government sorted programs of Medicare, Medicaid, and Social Security. You'll learn about eligibility requirements, basic benefits, and services provided by each. This section is full of medical terms, acronyms, and numbers. Note that dollar amounts for different types of Medicare deductibles change frequently and are provided as reference only. What is important for you to remember is who qualifies for each plan and what type of coverage they can expect. Terms to know. Benefit period is a period of time which benefits are paid under the policy. Enrollee, a person enrolled in a health insurance plan. And insured doesn't include dependents of the insured. Pre-existing conditions. Conditions for which the insured has received diagnosis, advice, care, or treatment during a specific time period prior to the application for health coverage. Premium, the money paid to the insurance company for the insurance coverage. Social Security disability insured status. That's a long one. Social Security disability insured status. Fully insured or currently insured, depending on the number of coverage credits earned. Wait period. A period of time that must pass after a loss occurs before the insured starts paying policy benefits. Moving into Medicare. Medicare is a federal medical expense insurance program for people age 65 and older. Even if the individual continues to work, Medicare benefits are also available to anyone, regardless of age, who has been entitled to Social Security disability income basis and for 2 years or has a permanent kidney failure in the final stage retinal disease SERD. Persons age 65 or older who have recent green card holders permanent residents, or new immigrants to the U.S. and never worked in the U.S. may not immediately qualify for Medicare. If they do not qualify for free Medicare, they can still purchase it if the following eligibility requirements are met: are 65 of age or older, have recently become a U.S. citizen or naturalized, and have worked enough quarters to have Social Security coverage, and are lawfully admitted aliens, green card holders, who have constantly lived in the United States for 5 years or longer and do not qualify for Social Security benefits. Medicare is administered by the Center for Medicare and Medicaid Services, which is a division of the United States Department of Health and Human Services. Medicare is divided into 4 parts. Part A is hospital insurance. It is financed through a portion of payroll tax, FICA. Part B, medical insurance, is financed from monthly premiums paid by the insured and from general revenues of the federal government. Part C, Medicare Advantage, allows people to receive all of their Medicare services through available provider organizations. And Part D is prescription drugs. For the prescription drugs coverage, Part D. Note, however, that the term original Medicare, it refers to Part A, hospital insurance, and Part B, medical insurance. It covers health care from any doctor, healthcare provider, hospital, or facility that accepts Medicare patients. It usually does not cover prescription drugs. Original Medicare does not require patient to choose a primary care doctor, nor does it require a referral to see a specialist as long as the specialist is enrolled in Medicare. Know this. Part A is hospital insurance, and Part B is medical. B, medical, A, hospital. Medicare. All the following are claims, terminology, and other key terms applicable to Medicare. Actual change or actual charge. The amount a physician or supplier actually bills for any particular service or supply. Ambulatory surgical services. Care that is provided at an ambulatory center. Ambulatory center. These are surgical services performed at a center and do not require hospital stay, unlike inpatient hospital surgery. Approved amount. The amount Medicare determines to be the responsible for the service that is required under or is covered under Part B of Medicare. Assignment. The physician or medical supplier that agrees to accept Medicare provided amounts as full payment for the covered services. Coinsurance. Coinsurance is the portion of Medicare's approved amount that the beneficiary is responsible for paying. Carriers. Organizations that process claims that are submitted by doctors and suppliers under Medicare. Comprehensive outpatient rehab facility services. Outpatient services received from Medicare participating comprehensive patient rehab facility. Deductible. the amount of expense a beneficiary must first incur before Medicare begins payment for covered services. Durable medical equipment. Medical equipment such as oxygen equipment, wheelchairs, or other medical necessary equipment that a doctor prescribes for use in the home. Excess charge. The difference between Medicare approved amount for the service or supply and the actual charge. Intermediaries. Organizations that process inpatient, outpatient claims on individuals by hospitals, skilled nurses facilities, home health agencies, hospice, and certain other providers of the health services. Limiting charge. The maximum amount a physician may charge a Medicare beneficiary for a covered service if the physician does not accept the assignment. Non-participating. Doctors or suppliers who may choose whether or not to accept the assignment on each individual claim. Outpatient physical and occupational therapy and speech pathology services. Medically necessary outpatient physical and occupational therapy or speech pathology services prescribed by a doctor or therapist. Pap smear screening provides for a pap smear to screen for cervical cancer once every 2 years. Partial hospitalization for mental health treatment, a program of outpatient mental health care. Participating doctors and suppliers who sign agreements to become Medicare participating. For example, they have agreed to in events to accept Medicare. All my papers are jumbled. These are 21, 21, 22, 20, 20, 20. Okay, we're going to take a pause.